Tendon's hand. Published by WordPress.com. Intersection syndrome of the wrist. Intersection syndrome is an overuse inflammatory condition affecting the wrist and forearm, particularly where the first and second extensor compartments cross. It is common in athletes and manual laborers who perform repetitive wrist extension and gripping motions. Anatomy involved. First extensor compartment contains the abductor pollicis longus, APL, and extensor pollicis brevis, EPB. Second extensor compartment contains the extensor carpi radialis longus, ECRL, and extensor carpi radialis brevis, ECRB. The condition occurs at the point where the tendons of the first compartment cross over the second compartment, approximately 4 cm proximal to the wrist joint. Causes and risk factors. Repetitive wrist movements, e.g., rowing, weightlifting, racket sports, and manual labor. Overuse injuries in athletes, e.g., skiers, rowers, and cyclists. Poor biomechanics or sudden increase in activity. Symptoms. Pain and swelling on the dorsal radial forearm, proximal to the wrist. Crepitus or squeaking sensation with wrist movement. Tenderness over the intersection area. Worsening pain with wrist extension and radial deviation. Diagnosis. Clinical examination. Pain, swelling, crepitus on resisted wrist extension. MRI, ultrasound, shows paratendinous edema around the affected tendons. X-ray, usually normal, but may be used to rule out other conditions, e.g., de Quervain's tenosynovitis, distal radius fracture. Treatment. Conservative management, first line. Activity modification. Rest and avoid repetitive wrist extension. Splinting. Wrist immobilization with a thumb spica splint. Ice therapy helps reduce inflammation. NSAIDs to relieve pain and swelling. Physical therapy. Stretching and strengthening exercises once pain subsides. Interventional treatment. Corticosteroid injection if symptoms persist despite conservative management. Surgery, rare cases. Surgical decompression of the affected tendons is considered for refractory cases. Differential diagnosis. De Quervain's tenosynovitis affects the first dorsal compartment only. Wrist extensor tendinitis, radial tunnel syndrome, distal radius fractures or arthritis.